we want to look at Joule burns. Joule burns. Okay, we're looking at Joule burns. Now, Joule burns, these are lesions produced at site of entry of electricity. Remember, these are in electricity wounds. This is site of entry. This will be the site of entry. You know where exactly he stepped on the current, where he touched the current. So there will be Joule burns. Joule, you know, is a electric term, right? Electricity. So definitely Joule burns. Okay. Now, Joule burns are lesions produced at site of entry of electricity of not very high voltage. This is not very high voltage, not very high voltage. So the voltage will be very less. In such cases, when there is no death or something, right? Basically, it will not cause death, let us say. Not that they have mentioned in this book, but this electricity voltage is not very high. And the heat that produced by this voltage, basically that will cause this Joule burn. Hold on. Okay, so these are called as endogenous burns. What are these called as? Say endogenous. Endogenous. Genus. Burns. Burn. Joule burns. Joule burn. Yeah. So when the electricity enters, right, at the entry point, there will be this kind of Joule burn. Okay. Next. The site. Now we are moving on to the site of Joule burn. So we are done with the introduction, guys. So now we are moving on to the site of Joule burn. It is commonly the exposed part of body, especially palmar aspect of hand. So you should remember it is mainly the palmar aspect of hands. Palmar aspect of hands. Palmar aspect of hands. Remember, it is mainly the hand that gets affected. Okay. Pathogenesis. What happens? Why exactly this wound is caused Joule burn? So when the passage of electricity happens, the blister is created by steam produced in heating of tissues, and when current ceases, blister cools and collapses to leave a crater with a raised rim. So first there is heat, okay, because of the electricity. There is heat, blister is created. So electricity, then heat, then blister. Okay, then the current ceases. When the current ceases, the blister cools. The blister cools down. Okay, and then what happens? It collapses and leaves a crater. Okay, with a raised rim. It's a pretty clear situation, right? You can understand. So now what are the Joule burn? What you can see is pale zone will be there, and then there will be raised border inside. Pale zone. Pale zone, yeah. So there is a pale zone, and inside it there is a raised border. Okay. So how exactly this gets created? First of all, there is electricity. After the electricity, there is heat. Heat will produce blister. Then the electricity will cool down, they are saying. The heat will reduce, right? The blister will collapse, and there will be a raised rim. So this is what is Joule burn. Okay. So we are done with the pathogenesis is done. Next we will move on to the features. Okay, so let's move on to the features, right? What do you say? So let's move on to the features of Joule burn. So features here we already have seen. The lesions are round or oval or irregular. So basically anything. Chalky white shallow craters 1 to 3 centimeter in diameter. So 1 to 3 centimeter in diameter. The diameter is so big, 1 to 3 centimeter. Hold in your fingers, 1 to 3 centimeter. Okay, that much will be the entry wound. Okay, the diameter. Entry wound. Yes, entry wound. And they have a ridge of skin. Okay, 1 to 3 millimeter high. So how high will the ridge, the raised be? 1 to 3 millimeter high. Okay, around the crater. Now the crater floor. They are talking about the crater floor. The crater floor is lined by pale flattened skin. Skin of lesion is pale, but there is mild hyperemia of adjacent skin. Okay, hyperemia of adjacent skin. The lesion becomes brown on prolonged contact. With further contact, there may be charring. So first it will be pale, the crater. Then they are saying it will become brown with prolonged contact. Further contact, if it is there with the current, there will be charring. Charring. Yes. It may have bright green color if the conductor contains copper. So if there is copper presence, then there can be green. The crater can be looking green. Occasionally, mark has distinctive pattern or shape of the conductor. So there can also be this kind of a pattern of the conductor or whatever the person touched, right? That pattern can also be left on the skin.
Pattern conductor.
Yes. Rarely it stimulate bullet wound if lesion is circular. So if it is circular, then it might look like a bullet wound, okay, to the person. If it is circular, it can look like a bullet wound. If the lesion is circular, penetrating the skin and muscle and even bone, then it might look like a bullet wound, okay, if it's penetrating the skin, the muscle and the bone, okay. So that is all about jowl burn. Okay, we have to complete the medico-legal importance. So basically, this will be with electricity entry of current. Entry of current. So they are specific and diagnostic of contact with electricity. Entry of current. That's all is the medico-legal importance given here. So we are done here with jowl burns. So that's all we wanted to say. You have to draw a kind of a diagram also you can draw in the exam where you can show like a finger or something, right? Mostly palmar aspect will be affected. So there's a pale zone here around which there's a raised ridge and a crater. So draw this kind of diagram to get more marks. This is pale zone, this is crater, and this will be your ridge, right? So those are joule burns, okay? So this is not caused by very high voltage. Voltage will be low, and it is also called as endogenous burn. Remember, it is also called as endogenous burn. Most commonly is the palmar aspect of the hand. Okay, then how it forms? The blister current creates heat, heat creates blister, then current ceases, the heat goes down, the blister cools and collapses to leave a crater with a raised rim. Okay, so remember it is also called as endogenous burns. Say
endogenous burn.
Okay, so that's all for now from our side. See you. Joule burns are covered. Bye bye.
Bye bye.